All right, everybody. So a lot of good questions on stability, right? And so that leads us right into this poor fella here. And I'm gonna ask you guys, do you know what the heck's going on with this guy? You know, with the different colors. You know, so one thing is, right? What do we see here? What kind of a pattern do we see? We got the blue, 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 green, green, green. Does anybody see an alternating pattern here? Okay.
The joints?
Yeah, it's the joints, right? So it's an alternating pattern at the joints. So when we start down here, we're going to talk about this is a universal thing, right? So this doesn't just pertain to runners, this pertains to golfers, people that play tennis, all of us, you know, that different joints of the body have a greater role than other joints, right? So they're either more stability oriented or more mobility oriented. So we take a look down here at the foot, and by the way, this trusty little model, I did not scare you guys by putting the batteries in here, but this is from Home Depot. It's like a Halloween skeleton. The eyes go red, 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 but it suited the purpose for what we needed it for. Except it's missing really a good part of the foot. So we start down here at the foot. Okay, so the foot, you know, Dr. Tingman spoke about this. That's your subtalar joint, that's your foot. That's supposed to be a stability joint. Okay? We get up to the ankle. The ankle joint is more of a mobility joint. It has a lot of degrees of motion available. And from that, we also have muscles that we want to have moving at those joints. Your gastroc, your soleus, and we also will stretch in the plantar fascia. So we're talking about mobility around the ankle joint. Coming back up to the knee, a couple guys in the audience, knee problems, a stability joint. And like Dr. Tinkin said, we're not just talking about stability here of ligaments or stability that you gain from your meniscus, because that is a stabilizer for the knee, but we're also talking about dynamic stability. And this is the place where we see, and it's funny because Dr. Tinkin and I have similar ways in which we evaluate these runners. And one of the things is to look at, you know, again, that kind of a squat pattern or a balance pattern, and we look at how does this whole thigh, so we'll sort of say, tied in with the stability is how the whole thigh either moves inward, which is 90% of the time. So if we were to test you guys, and I'll make sure, you know, my PTs upstairs at some point are testing this with you, that if that thigh is kicking inward, that's a dynamic instability that's probably going to affect you functionally. And so we are looking at, well, what's weak here? You know, what are some of the factors here? Is it the core? Is it the gluteus medius muscle on the outside of the leg? And a lot of times, I agree with Dr. Ting, and a lot of times that is one of the primary problems. So we're looking at the knee as a primary stable joint. The hip is a tricky one because the hip is more of a mobility joint, 6 degrees of motion. So we're talking about not only the ball and socket, but we're talking about the hamstrings, the inner thigh, the outer thigh, the glutes, and we want to make sure the piriformis muscle groups, we want to make sure we maintain good movement. And the interesting part about all this, as you can see as we move up the chain, if something is supposed to be a mobility joint and the muscles around it are not moving well, or the joint itself maybe has some arthritic conditions or, you know, cartilage problems and it's not moving well, it's going to try to rob that motion from usually the joint above or below. And the joint above or below is a stability joint. So it doesn't want to give up motion, it wants to be strong in the core and in your glutes. So if we're forcing that, then we're going to see a problem there. And then as we move up the chain, and then you guys will get the point, from the lumbar spine, we go up into this area in the thoracic spine. And I want to see a show of hands, first of all, in the room. How many of you guys put time into doing any flexibility, any stretching before you run, during run, you know, after warm up, or, yeah, good, okay. So there's a few that don't put that time in, that's okay, we might make you believers, but the majority of us do stretch. So I'm assuming that you stretch your gastroc, maybe your soleus, so we're going to look at some of those stretches. I'm assuming you stretch your hamstrings and maybe your inner thigh, outer thigh, the butt cheek muscle. Does anybody stretch this area up here in the thoracic spine? I'm just curious. You do? Excellent. Excellent. Why do you stretch that?
Because, let's see, it affects everything else.
Mm-hmm. So it's really interesting, right? Because the thoracic spine, well, and you can see it if you run, in front of a mirror, and you watch your own pattern of running, you'll see whether, am I moving my torso and my thoracic spine evenly? And if I'm not moving it evenly, if I look down the chain, do I also maybe don't see that same healthy movement elsewhere? So we look at things really from a functional movement very globally, not just in an isolated area. So I was doing a little walk jog yesterday on the treadmill, and of course I know this about myself because I always am looking in front of the mirror, not from an ego standpoint, but I always know that there's something off the rail. And again, with my running pattern, I could see that this right shoulder was just staying ahead of that left shoulder, and it never really was about equality for me. And then as I looked down the chain, I also saw that I really was not even extending through that right hip. So extension issues all up and down the chain. So that is definitely a reason why we want to actually have mobility at the thoracic spine. And I've included those in your packet of stretching, just one easy, rotation, side bend rotation. But the other reason is because, we want to get good oxygen. We want to be able to expand the lungs and get in all the fresh oxygen for those muscles so that you can go longer distances. So any areas that you see in green are areas that should be motion, muscles around those joints should be moving well. Any areas that you see in blue should have good stability throughout. And, for athletes that, are doing racket sports and other things, we really get into that, especially as we get up into the shoulder blades and the lower cervical spine and so on and so forth. But for you guys, we really want to emphasize, flexibility. So let's talk about that a little bit more. And we want to talk about injury prevention. So who thinks they have the tightest hamstrings in the room? All right, good. All right, let's all stand for a minute. We're going to see whose hamstrings are the tightest. Now, before we do this little motion piece, what I want to see is, first of all, does anybody have a problem with forward bending?
Just right now.
You do? Okay, so then I'm going to say maybe you're not going to do this little demonstration.
Yeah.
Okay, you'll see Michelle after her maybe. So anyhow, let's have you all get your legs close together, give yourself a little bit of space. And Shannon, I want you to check out too and see. First of all, so knees are going to stay straight. I want you all to forward bend, and I want to see how far you're able to go in that forward bend. And I want to know, is anybody not being able to touch at least their knees? Keep your knees straight, and then come on back up. Is anybody not touching the knees? Raise your hand. Okay? Ken, you're not touching your knees?
I got it.
Okay, all right. So Ken is maybe one of the subjects. All right. So let's see who can touch the middle of who's only able to get to the middle of the shin. Do it again. Middle of the shin, people. Okay. All right. You're definitely part of that. Come on back up. Yeah, you're definitely part. Anybody else?
I got angles.
Okay, good. All right. Do you mind being a little subject? Okay, come on up. Ken, I think you better come up. We need 3 people. And it's no coincidence. It's the men in the group. Come on. Come on. Typically, women do have more flexibility than men. Usually, right? But flexibility is something that we all have as babies, right? And so where do we lose this along the way? So there's a couple ways in which we're just going to take the hamstrings as one muscle group. So we're going to do a little experiment. So Shannon's going to help me. So you guys, let me see. Roll up that pant legs for me because we're going to tag you and we're going to see. We're going to see the truth of how far you're able to go when you forward bend, and then I'm going to give you each 3 different ways in which we're going to work the hamstrings and see where we get the greatest success. Okay. So, feet together. What's your first name again?
Yeah.
Gary. Feet together, Gary. And I want you to go ahead and stretch forward for me as far down as you can go. Keeping those knees straight. Yes, you bet. No bouncing. That's a cheat. And so we'll say we're going to tag him up just for the fingertips. All right, come on back up. I'm going to hit you one more. Shannon, my trusty assistant here, take 2 and tag up Ken, and then together, gentlemen. And we'll just sort of see. We'll do a little experiment here with kinesio tape. It's never been used this way before. All right, keep your knees straight and bend forward again. Okay. You're kind of cheating there. That's it. Oh, you kind of cheated on me there. to the air, and I'm gonna bring you back up to the air. All right, okay. So you're gonna be subject A, Gary, okay. Good. All right, tag. Did you get that far? She's not because she used to work for you.
I've done it a few times.
All right, okay.
Yeah, exactly, yeah.
More than.
This test should be age handicapped.
Right. Exactly. Well, like I said, we all have this kind of flexibility coming into the world, so we can get it back, right? Okay. So let's talk about 3 different interesting pieces, and then we're going to have the men in the class here see what works for somebody. So one way in which we work with flexibility is going to be through dynamic stretches. So of course there are static stretches that people can hold, or they can hold for periods of time. We don't love them as much, and if you do static stretches, we typically will do those after your run, when you really have tremendous pliability. And when we do a static stretch, if I were going to do a stretch, for my hamstrings, and I was going to do a particular one, I would be doing a static stretch where I would be doing breath work. Where I'd be taking breath in and breath out. And I would do about 5 breaths, but we're not going to do that. We like to do a lot of active stretches. Active stretches can be part of your warm-up. So this is going to be good. So Shannon is going to instruct Gary.
Yep.
Player A here in this. And so I'm going to show you first, and then Shannon's going to keep an eye, and she's going to keep you honest. You're going to do 10 repetitions of the legs in the straight position, and we're going to turn them a little in and a little out, okay? And it's not going to be anything deep. I'm going to show my tush to the classroom, so hopefully I don't offend anybody. But, so what we're going to do is he's going to do something we call hip hinging, and he's going to send his tush back, and he's going to use the end of the table here, and he's going to bring his torso down, so he becomes the letter L, okay? One big L, right angle. And then he's going to do just a small bend, and then he's going to just straighten on through. Nice and easy. Shannon's going to keep him honest, and he's going to do that particular stretch with the legs in the straight alignment, then he's going to turn them a little in, and then he's going to turn them a little out, so we get different branches of the hamstrings. I need your shoes off, because you're going to get a really good job here. Ken... I'm just going to, before we do it, we'll talk about Ken's role. So with Ken, we're going to do something else that we sometimes do with hamstrings, is if you activate the front of the body, you inhibit or you quiet the back of the body, right? So we're going to do a little sneaky little trick here with Ken. And what he's going to do is he will have a little space here. And the first thing he's going to do is we're going to have him with his toes up on this little RX pad and his knees bent. And we're going to put this ball between his legs. All right, now, when he squeezes the ball, his adductor muscle group, it also turns on his abductors, his belly muscles, and it quiets the hamstrings in the back. So what Ken, you're going to do, is you're going to keep the knees bent. First thing you're going to do is, I want you to succeed. So I want you to be able to touch your toes. Because your brain needs to remember that you can do this, right? So here's what you're going to do. You're going to keep your knees bent to the degree that you need them bent so that you can touch your toes. And then each time you're going to go a little straighter, a little straighter, a little straighter. So you're going to do 10 of these. So watch now. So squeezing the ball, you're first going to raise the arms up over the head, and then you're going to keep your knees bent until you can touch those toes. Keep squeezing the ball, and you're going to come up. And I'll keep you honest. And as you feel like, okay, I'm stretching out a little bit, you can go straighter and straighter. Now, notice that we have the RX pad bringing his toes up to him, so that gives him a little advantage. Okay, so this is a little trick. After you do 10, Ken, you're going to get to the end here. And you're going to do the same thing. Now your toes are further away from you, right? Same thing, over the head, and then touch your toes. And over the head, touch your toes, and you'll get straighter and straighter and straighter. And then the last thing you're going to do is you're going to wait. Because then we're going to test and we're going to see how you do going straight down. Okay?
All right.
So, actually, no, I will let you do that last part without all this, and you'll just come back and forth, and you'll do 10 of those. Okay? So I'm going to set you up for that. And contestant C, I forget your first name. Dave, you get something really easy, right? You're going to do something that the work is from Tom Myers. It's It's called anatomy trains. And anatomy trains are using myofascial patterns in the body that are connected in pathways. So we're going to use a posterior chain hamstring, and we're going to access it by accessing your plantar fascia. So what you're going to do is you're going to have a seat for me, and while they're doing all their repetitions, you're going to sit and you're going to roll this ball, and I want you to get into this plantar fascia, and I want you to give me with this. Let's see, you guys get 30, and you're doing 30. So give me 30 on this one, and then switch feet, and 30 on that one. And then we're going to see who wins this contest. Okay, so you guys have the edge here. So first thing, toes up on this. Put the ball between your legs. And you're going to squeeze in there
into that L position.
Stretch up over the head.
Apart.
Keep your knees bent so that you can touch your toes, Ken.
All right,
So
and we're just going to
keep squeezing that ball.
So you're setting your toes all the way back and your hands all the way forward.
When that starts to get
Arm
easier,
skeleton, and you want to try and get
The
as
shamey Dutch.
far as that.
when that starts to get easier, all right, no worries. We'll see you.
Chris, is
Thank
there going to be a winner, or are they all good and we'll see you next week?
I don't know. We're going to see. We're in the
Just a
unknown.
little bit for me. Bend your knees. And then sink your toes all the way back.
And then, have you been able to do it straight yet, Ken?
So,
Good.
yes.
Yeah, good.
Can you feel it in the back?
More good. And then it shakes over.
Okay, they do look tight too.
Good. Good.
Slight bend. And then come back.
Yeah, it is a little low for you. You're right about that.
Gary, he's a problem.
And then continuing, we'll do 10. So that's number 5.
And Gary, is that okay on your knee, that amount of bend when you do the bend? Good. So it's just a small unlocking of that muscle. It's getting him in the tendon, and it's getting him mid-belly of the hamstring.
Just the bottom.
Yeah.
How's that rolling
That's a
coming
really interesting
along?
one.
Mm-hmm.
See if that one works.
Yeah. Anatomy trains. It's really cool.
This looks like a ballet.
I know, right?
Avant-garde.
Alexis, how are your hamstrings?
Not bad. I've been working on them for.
Did you do the test?
I did. Yeah. I've been trying to heed my own advice with
Good.
So
now you're going to
cross
put your
training,
toes
and
out
also
just a
the
little
dynamic
wall.
stretching.
Flat footed, give me 10, keep your knees straight.
There you go.
Dave, I'm pulling for you. I'm pulling for the easy way out here.
Ooh, look at that.
Look at those feet closer together for me, Ken. That's impressive. Uh-huh. So this is a wow
I'm
moment.
sure they're back.
Right, it's a good looser.
A lot of difference, right?
All right, 2 more, and then we're going to put our toes out.
Good. Did you do your 30? Good. Okay, then the suspense will be. You already know this guy's got it, he's got it going on, right? What do you think, Ken? So, yeah, did everybody see that Ken was at least down to his ankle? Yeah. So that is with reflex inhibition, so that was a great little magic trick. And he was also stretching through the hamstrings, but the one muscle opened up the gateway for the other one to have more mobility. Okay, good. Good. Dave, put your feet together. All right, let's check out Dave here. Keep your knees straight and then go ahead and take it down. All right. So maybe it wasn't long enough, or maybe you need another little trick, and then come on back up. Okay.
Stand on up.
So that's interesting, right? Okay. All right.
Do you feel looser at all?
Pardon
Do you
me?
feel
All right,
looser?
now let's put your feet together.
Not necessarily.
And let's show the audience here, now don't cheat. Go ahead and take that down. All right. So here, you're relatively the same. Okay. Thank you for participating. He won on that one.
This was the
Yeah.
most work.
Yeah. Now, what I'll say about that,
Just did that one way.
Chris, do you often will try different? So if one is not open them up, you try different
Yes, and what I was gonna say about that is that, so a lot of times you guys can do, flexibility and stretching on your own. And when you're not able to make changes or gains, that's where, a practice that does manual work comes into play. Because one of the things that we do in our practice, we do a lot of pieces with manual work, probably a good half an hour with our patients before we integrate exercise. One of the things we do is active release. So active release gets right into the muscle tissue in a shortened state, and we actually go with that person through a lengthened state, and that really opens things up really nicely. I've seen it in the neck, like amazing. People get maybe 10 degrees more motion right away, which is great. Then they keep it with exercise. We also use techniques of soft tissue massage. We do Graston-like instrumentations, but not as hard as the Graston instruments. We do different ones. So we do a lot of techniques to just help with that mobility if somebody's just not making any gains and it's affecting them. Like for you with those tight hamstrings, that will absolutely affect your patellofemoral joint. Just like tight calves, tight hamstrings, and IT bands. So maintaining that flexibility gives that little kneecap a little bit of a buffer, a little bit of breathing room instead of all this compression down close to the bone. So that's important, okay? So I don't want to go into too much more with flexibility because I gave you guys a great exercise pack, and it also, if you go on our website, we also made a video for you. So on our website, you can go to educational videos, and there's like a 9-minute video of all kinds of great runner stretches covering these green areas of the body that need to have the muscles moving. And I will say that, it could also be, when we look at somebody that, it's not a muscle issue, it's a joint issue. And the joint is just not moving well. It could be an arthritic joint, and so then you definitely need skilled care because there's different things, that we do to try to open up that space and try to create a little bit more, if it's a labral tear in the hip or whatever the case may be, and nobody wants to rush into surgery as a first resort. We want to try to create space, and that's one of the skill sets that we have as PTs. Okay? So, so that was a lot of fun. Thanks for my participants. And now there's no excuses for not stretching there, Ken. But you're probably a good stretcher. You said you're converting.
I need to, apparently.
Yeah.
I need to.
But the older we get, these are the types of things. The older we get, we lose hydration in the muscle, the tendons change a little bit, and so we need to actually put the time in to do that. When is the right time to do stretching? Is it, before you do an activity? Anyone?
Just a little bit, maybe just engage.
So we'll usually encourage like a 5-minute, just get the body temperature warmed up a little bit, and then do your stretches. And maybe the dynamic stretches that we're giving you in the packet, there's movement there. So that's actually part of a nice warm-up for you. And if you're going to do static ones, with mindfulness and holding instead of movement stretches, then save them for the end. And definitely want to stretch after. You're under the nice endorphin high, take advantage of it. So you definitely want to do that. Yeah. So that's that on those issues. Now, the hip is a tricky one. I should probably have a piece of blue around the hip as well as the green because, like Dr. Tingen said, a lot of issues come from core instabilities, glute, maximus, your butt cheek muscle, as well as the medius, but especially the medius, and for the same reason. So we're in harmony with that. So when we do a particular screening, we look at somebody, like say somebody comes in and they say, Chris, I'm super flat-footed, and is an orthotic something that you think is right for me? We would comprehensively look through that from the top, the middle, the bottom, and we say, all right, what's this look like for this person? Where are they falling apart? Where are they the most vulnerable? So one of the ways we also do that, besides doing that little unilateral squat like Dr. Tingen was demonstrating, is we do something called a step-up test, if the person can tolerate it. So we just put a step stool there, and we're like, okay, so take a step up, and now just kind of hip hinge and send that knee back. And let's watch and see how that is. If we see them, all over the place and caving in, and then we say, I'm also looking at the foot and I'm looking at the hip. Who's the big problem here? oh gosh, it looks like the hip's more of this problem here. The hip stability, they're just not controlling it. Well, let's get going with that first. And now let's see. Oh, okay, now they don't need that orthotic, or maybe they still do. Maybe they just have a bad hip or a bad knee, or let's say somebody who has had kneecap problems, or maybe a posterior tibialis. It's a very skinny little tendon on the inside of the foot. And I'm telling you, that posterior tibialis, if it's overstretched with somebody who's a really, deep hyperpronator, that kills your ability to raise up on your calf. I call it the fire starter, the grill starter. Because if you have this great big calf muscle, your gastroc and your soleus, but you take that posterior tib out and you ask them to raise up under here, there's no way they can do it. It's done, right? So, and it doesn't just typically tear, it just gets soft and it just becomes dysfunctional over time. So if somebody is a candidate for orthotics, then absolutely we look at it very comprehensively. If we do make an orthotic for somebody, I cast for that in-house. These are super lightweight, I pass it around. I do ones that are full length and also ones that are dress shoe length. But not everybody's a candidate for it, so it's not like you're just going to come in and we're going to be like, let's take your shoe off, we're going to cast you. We're going to look at these other factors that are important. So you can pass that around and see how lightweight those guys are. So from a stability standpoint, so I'm going to bring Shannon up. So I talked about, we like to get stability from the deepest layers of the core, right? And most people don't know what that is. They think it's the rectus abdominis or their obliques or their erector spinae, and that's more of a superficial core. We need to get underneath that to stabilize the back, sacroiliac joint. The pelvic floor is part of that, right? So, we're not shy. We bring all that into play. So I'm going to show you a couple exercises, and I'll put Shannon up here for a moment. And we'll start with the bridge, because the bridge is something we'll just put, since she left, we'll give this seat to her, yeah, for him. And Shannon, we won't disrupt the other feet here, but let's just get you, for the moment, lying on your back. Ken, we'll put these right back up here. Lying on your back for us. So, like I said, I don't really like to give these exercises out because there's so much prep work to do it right, to doing it correctly, right? So, but if I were to say this to Shannon, I'd say, okay, Shannon, we're going to tighten up your deep core. Shannon knows that one of those muscles is your transversus abdominis, right? And that's the corset muscle. And when we contract transversus abdominis, it like draws us in without changing the curvature of our spine, right? It's very different than like a posterior tilt. The intention is totally different. This is a drawing in, and we couple that with using the second deep core muscle is your diaphragm, right? So the only way to really use the diaphragm is to, like we're steaming, we're fogging up a glass, or fogging up a mirror. So Shannon, I want you to take a breath in, and as you exhale, go ahead and draw that rib cage in, and she is not going to flatten her low back with this. And do it again for me. So she's going to draw her rib cage down and in, and she's going to zipper herself up. You'll see a lot of people that have a splitting of the fascia in the center, men and women, right? So you see sometimes women from pregnancy, they get erectus diastasis, it splits. And when they go to do any work, it looks like a big wave is coming up. You see it in men too, right? Men may be carrying extra weight in their center, and when they go to do this, it's a big, big, tidal wave that happens here in the front. And we want to encourage zipping that stuff together, not opening it and splitting it further. So this is just turning on the deep core, and now we're going to add the pelvic floor. So we always tell patients, okay, as you tighten up here and as you're exhaling, bring on the pelvic floor, lift it, men and women same, lift it as if you're trying to hold back the flow of urine or holding back gas, right? So if you were out somewhere, you'd be just pulling it up and in, okay? So we don't have it out, right? So that's part of that, is to just get the deep core on, right? Next piece is then squeeze your butt cheeks, okay? So activate your glute muscles. Now from here, core on, squeeze the glute, Shannon, exhale, and lift your buns off the ground. Now, One thing that she's not doing is she's not throwing her back into it, you know, because that would create back pain, and then bring it on down, okay? Tighten up the deep core first, then the glutes, exhale and lift. So this is a great one, and go ahead and take it up again. It can be started down in this kind of a foundation level. We're looking for evenness, we're looking that she's not dropping one side versus another, right? And one big question is, where are you feeling that, right? So go ahead, we get a lot of guys, get up there, oh my God, my hamstring, my God. And that's because they're so weak in their glutes that they forgot how to use them. They're not using them, so their hamstrings are trying to be like brothers in action. They're trying to help out with this. The hamstrings and their low back instead of the glutes. So this takes training. That's why I'm not like a fan of just throwing these out to you and say, oh, go do these, because you can easily do them wrong. But that's fun, right? So that's for the glute maximus, right? And then let's have you come on off the table for a minute.
Can you feel that one in your quads?
You feel
Because
it
when I
in
do
your
yoga,
quads.
they're always saying it's for your quads.
It's not, right? It should be lifting from your buns, from your glute maximus. When you do that, the truth is 70% comes from your glute maximus, and like the other 30% comes from your hamstrings. Your quads will feel taut, of course, because they're in the bent position, but they're not like a big lifter, okay? And if somebody can't get it all together, we say, all right, you're not allowed to use your legs. We're going to put a bolster or foam roller underneath their legs, and we're going to take that out of the equation until we teach them how to do that properly, okay? So then we talked about, Dr. Tingen talked about the glute medius, and so a lot of people, Shannon, will you tie it up at the ankle for me?
On you or me?
On you. You're the ones who go to work. So glute, medius strengthening. So one exercise with this, and it's in your little packet too. Okay, is again we do a lot of work in front of the mirror, and I'm going to ask Shannon to get really super tall. And to be honest with you, before I teach this, we're doing a lot of balance work on one leg. Because if you can't do balance work on one leg, how are you going to now move the other leg and do? This is harder. Okay. So what she's going to do is she's going to get really tall. She's going to turn that core on. She's going to then just balance on that leg and out and in slowly. And you can do this without the TheraBand. What we're looking for is she keeps her pelvis completely level. We don't want to see elevation or dumping of the pelvis. We don't want to see corkscrewing coming around in rotation of the pelvis. So the pelvis is a key player. And how does that feel for you? So you might start off no band at all, and you might start off doing 10 of those, and then work to 20 in a row, work to 30 in a row. And if you don't think which leg do you think is going to be screaming? Like right now, if she did 20 in a row, and she's moving that left leg, which leg do you think is going to be screaming? That's right. That's right. Because the opposite glute medius is balancing that pelvis. Okay, that's great, love. Put it up at the knees, and let's show some monster crawls. This one you have to be careful of. If you're having patellofemoral pain and it hasn't been addressed yet, okay? But anytime you do a squat, there's a difference between doing a squat using the posterior chain and a squat using the anterior chain, okay? So a squat using the anterior chain, this is before she does it, would be the good old-fashioned wall slides. Not a fan of those guys. Where your back is flat against the wall and then you're sliding down. Right now, there's no hip hinge, right? And all the pressure is on the front of my kneecap. And it feels terrible, okay? And then coming up. The kind of squats we like to teach are posterior chain squats, which means that you, again, hip hinge. And now, when I hip hinge, look at me. And honestly, I cannot go that far. If I were to do that like a piece of toast, and I weren't sending my buns back and I kept... Right here, I can squat and then I can go down, and I'm putting the forces instead of right on the front of the kneecap. It's in the posterior chain, the back of the leg group, okay? So she's going to show you monster walks with a good hip hinge, okay? You can face them and just go down towards Michelle. So she's going to get into that position as if she's a basketball defender, and she's going to take a step, and then she's going to pull it in. Now she's keeping her core engaged. Okay, and she's breathing. You can relax your arms, but breathing, yep. So if she does strides down this way right now, she's working her left glute medius. But there's just great little exercises that you guys can put into play. Was there one more, Shannon? Was there one more in that packet at the end, at the very end?
Taking the foot back. with the band around the ankle.
The tie.
Oh, you can also do, yeah, you can do extension too, show extension. And then I'm gonna turn it over, definitely to Ken. We'll put this room back together for him. So tie that around your ankles and then just show that one, yeah.
So for the gluteus minimus, medius, is that, so the monster walk, she would say, is one of the
Yeah,
really targeted
monster
area?
walk, but I have patients that can't even do that, and we just tie a band around their leg and they just do sit to stand in the chair. And they push out against that because this is so, it's so inactive. And then she'll be extending that straight through, but she has to get the core on, right? So she protects her low back as she extends the leg. If she didn't do that and she didn't tighten up her core, there'd be nothing opposing that motion, and she might go really far into her back, and she might get some pain in the joints. Okay? So, most important thing, takeaway, is, we do a lot of education in doing these exercises correct. That's the most important thing. Stability exercises, mobility exercises, orthotics if, somebody needs them. And I'm going to turn it over to Ken.